Hello everyone, welcome to another lesson from Nursing with Jemmy. Today we are going to learn about the Glasgow Coma scale, that is GCS, or it is also known as Neurological Assessment Scale. So let's start. The Glasgow Coma scale was first published in 1974 at the University of Glasgow by neurosurgery professors Graham Teasdale and Brian Gent. So in 1974, neurosurgery professors named Graham Teasdale and Brian Jennett discovered or first published in the Glasgow Coma Scale. The Glasgow Coma Scale is used to objectively describe the extent of impaired consciousness in all types of acute medical and trauma patients. The scale assesses patients according to three aspects of responsiveness. The three aspects covered in the Glasgow Coma scale is eye opening, verbal response, motor response. For eye opening, the minimum score is 1 and the maximum score is 4. For verbal response, the minimum score is 1 and the maximum score is 5. For the motor response, the minimum score is 1 and the maximum score is 6. So together, all the responses we can see in a patient, the minimum score should be 3 and the maximum should be 15. Reporting each of these separately provides a clear communicable picture of a patient's status. So before performing the GCS test, it is important to do a preliminary test so that no factors hinder our assessment, like patient has no sedation, no paralysis, hearing impairment, or any other factor. Before checking the GCS, we have to make sure that patient doesn't have any factors that will hinder our GCS scoring. So the scoring and parameters is divided into three parameters: the best eye response, best verbal response, and the best motor response. So the best eye response is called as I. Best verbal response is V and the best motor response is M. The level of response in the components of the Glasgow Coma scale are scored from 1 for no response up to normal values of 4 in eye opening, 5 in verbal response, and 6 in motor response. The total score thus has values between 3 and 15, 3 being the worst and 15 being the highest. Now let's see the eye response. First one is eye opening spontaneously. If patient opens eye spontaneously, then eye will score 4. Second one is sound, verbal stimuli. If patient opens eye on calling or asking, then I will score him as 3, that he opens his eye to speech. Third is to pain. If patient opens eye on giving any painful stimuli, that is on pressing trapezius, supraorbital notch, then I will score him 2, that my patient is opening eye when I give him some kind of pain. So the score will be 2. Last one is no response. That means if there is no response, I will score 1. Even after doing so much, even if after asking or giving painful stimuli or calling, he is not opening his eye. That means there is no eye opening. So I will score him as 1. Now let's move on to the verbal response. Verbal response minimum score is 1 and the maximum score is 5. The first one is oriented. If you ask a patient, where are you? If he replies with a correct answer, then I can score him 5. That means if I have asked him, where are you? And he is in a hospital and he says that I am in a hospital, that means I can score him 5. Second one is confused. If I ask him, where are you? And he replies, I don't know, maybe at a hotel. That means he's confused. So I will score him 4. Now the third one is words inappropriate used. Like if I ask him where he is and if he says some random words like hotel or something else, then I will score him 3. Then comes the incomprehensible sounds. If he, she makes some sort of sound like e, ah, then the verbal score is 2. And last one is no response. Even after repeatedly asking there is no response, then I will score him 1. The last one is motor response. The first thing what we will assess is obeys command. If he obeys command, I will score him 6. If you ask the patient to protrude his tongue out and he protrudes it, That means he obeys command. So I will score him 6. In a motor response, the minimum is 1 and the maximum is 6. The second one is he moves to localized pain. So if I'm giving some kind of pain, she correctly localizes the pain, then I will give him score 5. Third one is withdrawal to pain. So if I do some painful stimuli, if I give some painful stimuli, he like withdraws his hand or withdraws his leg or tries to withdraw, then I will score him 4. Next is abnormal flexion to pain, that is decorticate posturing. So I will show you in the next slide what is a decorticate posturing. So if he has a decorticate posture, if he shows some decorticate postures, I will score him 3. The second one is abnormal extension to pain. I will score him 2 if he shows some decerebrate posture. So in the next slide, I'll show you what decerebrate posture means. It is abnormal extension to pain. And the last one is no motor response. If he shows no motor response, then the score will be 1. So this is how decorticate posturing and decerebrate posturing looks like. Decorticate posturing is abnormal flexion, whereas decerebrate posturing is abnormal extension. So after assessing the patient, we have to sum up the scores that will be the GCS score of the patient. So it will be somewhere around 3 to 15. Uh, so in that number, we will come to know how our patient is responding or what is the neurological status of the patient. So there are times when we cannot assess the patient for eye response or for motor response or for verbal responses. Sometimes patient may have verbal difficulties, like maybe patient has tracheostomy or intubated. Then what I have to mention in my report is non-testable. If patient has some difficulty, we cannot assess that part. That means it is non-testable. If patient has paralysis, then I have to put non-testable motor responses because of paralysis. So this is all about Glasgow Coma scale. I hope you liked my video. If you liked my video, please like and share. Subscribe. Thank you.